Welcome to The Explainer. So, today we're totally stripping away the fluff and all that marketing jargon that usually completely surrounds the word wellness. You know what I mean. Instead, we're digging straight into the hard, rigorous clinical data put together by Dr. Ahmad Alhamdani. We're going to see exactly how preventative health and structured lifestyle interventions, they aren't just, nice to haves. They are actual, scientifically proven medical treatments.
Okay, let's dive right into this. Here's our agenda for the structural blueprint we'll be building today. First, the chronic disease crisis. Second, the 7 wellness pillars. Third, mastering behavior change. Fourth, building wellness programs. And finally, proof that wellness works. Let's get started. Section 1, the chronic disease crisis and the global impact of non-communicable diseases. To really grasp why this whole architecture of wellness matters so much, we have to establish our baseline. And quite frankly, the baseline statistics of our global health are absolutely terrifying.
Just look at this number, 74%. According to the World Health Organization in 2023, non-communicable diseases, we're talking things like heart disease, diabetes, respiratory illnesses, they now cause a truly staggering 74% of all global deaths. I mean, that is literally the defining health crisis of our time. It immediately establishes the absolute highest stakes possible, not just for the medical community, but for us as individuals.
But here is where we do a quick so what check-in. If the death toll is really that high, are we just totally powerless against our genetics? The good news here is absolutely not. Between 70 and 80% of these chronic diseases are driven by modifiable lifestyle factors. As Miller's 2026 research clearly points out, targeted lifestyle interventions can prevent, treat, and in some cases, actually scratch that. In many cases, completely reverse these diseases. The real power is literally hiding right there in our daily habits.
Section 2, the 7 wellness pillars, the foundation of health. So, how do we actually harness that power? We need to move from that massive macro-level problem to some really specific physiological solutions. We do that by constructing our wellness architecture on top of 7 load-bearing columns. And here they are. Nutrition, physical activity, sleep, stress management, substance use reduction, social connection, and digital tools. Now, you might be successfully managing 1 or 2 of these on your own, which is great, but the clinical data is abundantly clear on this. Multi-pillar programs produce the absolute strongest clinical outcomes. They work synergistically together, kind of like a giant puzzle. So let's break down exactly what the evidence says about the most critical ones.
First up is nutrition. Based on some really robust data from Estruck and WHO looking at plant-forward and Mediterranean diets, the practical daily recommendation is actually remarkably straightforward. Basically, 50% of your plate should be vegetables, 25% whole grains, and 25% lean protein. And I always find it a bit funny that the most clinically proven, highly recommended medical advice for metabolic health is also the absolute oldest piece of advice we all consistently ignore. Yep, just simply replacing sugary drinks with plain water and reducing ultra-processed foods. It's incredibly basic, but biologically, it's profound.
Then we have physical activity. The target we're aiming for here is 150 to 300 minutes of moderate activity every week. Now, according to a landmark 2012 study by Lee and colleagues, simply moving from being totally inactive to moderately active reduces your overall mortality by 20 to 30%. No way, right? But what does that actually mean on a human level? Well, it translates to lower blood pressure, dropped HbA1c levels, so way better blood sugar control, and reduced LDL or bad cholesterol. Not to mention a massive boost in your functional capacity and a really significant decrease in depression.
Next up is sleep, which is our essential recovery phase. Optimal sleep is strictly 7 to 9 hours a night. When you're getting less than 6 hours, you are biologically driving up your risk for obesity and cardiovascular disease. But hey, if you struggle with this, there is a very specific clinical tool you need to know about. It's called CBTI, or Cognitive Behavioral Therapy for Insomnia. As Irwin's 2015 research proved, it is the absolute most effective treatment for chronic insomnia. And amazingly enough, it actually outperforms medication in terms of long-term efficacy, a real game changer.
And we absolutely cannot ignore social connection. This one, unfortunately, often gets left right out of the medical conversation. But look at this comparison, which is anchored in Holtlandstad's 2010 data. Strong social ties literally have life-saving power. We're talking about reducing all-cause mortality by roughly 50%. Compare that to the severe medical risks of social isolation, which acts as a massive accelerator for depression, dementia, and cardiovascular disease. Connecting with others is, well, it's quite literally medicine.
Section 3, Mastering Behavior Change, the Wiring of Wellness. Now, what's really interesting about this slide is that knowing the 7 pillars simply isn't enough.
We have to figure out how we actually get people to stick to them using proven psychological tools.
Because, let's be real, you can't just tell someone to eat better and expect it to magically work. You need evidence-supported behavior change techniques. Based on Mishy's 2013 research, these are basically the psychological switches that keep our wellness habits turned on. We're talking about setting smart goals, doing deliberate action planning, self-monitoring through logs or apps, receiving continuous feedback, leaning heavily on social support, and actively problem-solving for those pesky daily barriers. This right here is the true science of sticking to it. And, while we absolutely live in a golden age of wearable technology and health apps, a 2022 study by Wang points out a really critical caveat. Yes, for sure, digital tools are completely fantastic for self-monitoring and goal tracking, but they aren't magic pills. To get the absolute best clinical outcomes, these tools require genuine human connection. They demand real human coaching and tailored feedback to actually change long-term behavior.
Section 4. Building wellness programs, scaling the habits. So, we know the pillars and we know the behavioral psychology. But how do we scale this up? How do we take this from the individuals sitting at home and bring it to an organizational level?
Let's move to our next point and see exactly how this builds into a structured clinical program. The blueprint requires 3 really rigorous steps. First up, assessment. This means checking BMI, lipids, and a person's readiness to change. Second is the intervention package itself. That's deploying targeted nutrition coaching, sleep hygiene, and stress management. And third is follow-up. We're talking monthly check-ins for the first 3 to 6 months just to make sure those behavior change techniques are actually sticking. Now, when you take that exact blueprint and fully embed it into a workplace culture, you end up with a dynamic environment that actively fights absenteeism and burnout. This looks like gaining active leadership support, for starters, then implementing healthy food policies in the cafeteria, and using what's called active design. Think highly visible stairs or really clear walking routes. It also means providing crucial things like protected time during the day for wellness activities, and maybe running group challenges for steps or hydration to keep things fun. Section 5. Proof that wellness works. Clinical outcomes. All right, I promised you evidence earlier. We've talked about the theory and the structure, so let's transition to our final section and look at the real-world clinical and organizational outcomes of these structured interventions. And this brilliantly illustrates exactly why we do this. Just look at these hard numbers from a 6-month case example of a wellness program. An 8% average reduction in weight, a 12 millimeter of mercury reduction in systolic blood pressure, a massive 22% increase in daily steps. And from an organizational standpoint, a 40% reduction in high stress scores and an 18% drop in sick leave days. Honestly, this proves beyond a shadow of a doubt that a structured wellness program is a rigorous medical intervention that provides a huge return on investment for both the human body and the organization itself. If you take away only one message from this entire explainer today, let it be this core truth. Lifestyle interventions are evidence-based, not optional, period. Wellness is a measurable, physiological science. It isn't just some luxury perk. It is a fundamental necessity that absolutely must be embedded into our clinical practices and our daily workplace cultures. So, the crucial point is this. Take a look at your own life, your own clinic, or your own organization. Are we going to remain totally content with merely treating the symptoms of the chronic disease crisis once they already appear? Or are we finally ready to implement this blueprint, change our lifestyles, and actually address the root cause? The evidence is right here. The choice is yours. Thanks so much for learning with me today.